Brandon, great to see you.
Good to see you too. Well, while folks are sort of rolling in on the webinar, maybe just start with like where are you calling in from today? Where are you based right now?
Yeah, I'm in downtown Seattle right now at one of the Amazon buildings. It is
Okay.
a very foggy morning here in Seattle, but
Yeah.
we've been having great weather up until all this fog. How about you?
Sounds sounds about right. And we were just talking before, I'm a former Seattleite, so I know it well. I actually used to live right down the street from the Amazon campus there. I'm calling in from Park City, Utah, where it is beautiful, sunny, but like 5 degrees outside. It's pretty cold. We've got a really exciting topic. This is one that honestly, this is one of the topics that got me into healthcare. Was just how do you make it easier for people to get care? I mean, it sounds so fundamental. Really excited about this conversation. I think that, and excited about doing it with Leslie and One Medical. I started Nava because we wanted to make a positive impact on the healthcare experience of the average American. That is literally foundational to Nava's mission. It's a focus of what we do every single day. And so that's why this topic is so near and dear to my heart, transforming healthcare access and member experience. What is the role of employers in driving primary care and better health outcomes? It's so foundational to everything that we're trying to do when we as HR teams and employers are building benefits and healthcare plans for their employees. And so we're going to have a really great conversation here. I'm with Leslie at One Medical. We'll do intros in a second, but really sort of goals for this conversation or to walk through and really educate folks on a few things like why healthcare access matters so much. Like, why is this system so in need of change and modernization? What modernization actually looks like when it comes to making it sort of delightfully easy for your employees to like get that well visit, get that primary care, preventative care into themselves and their families. And then Leslie and the One Medical team think a lot about what does the future of this look like, what's around the corner. And so we're going to talk about looking ahead, what are trends, strategies that employers can use to really sort of make this true inside your organization. Maybe before we dive into too much stuff, I want to do a bit of introductions with Leslie and myself. So Leslie, why don't you start? I'd love to get an introduction and
Fantastic.
kind of introduce yourself to the team.
Great. Well, my background has been in employee benefits. I earned my master's in healthcare administration and then went directly to work on the carrier side, have been on the broker side, and then most recently on the healthcare tech and point solution side. And while at Amazon One Medical, I oversee our channel partnerships. And what we mean by that is we work with single entities to offer Amazon One Medical to a variety of employers. So our partnership with Nava Benefits has been very critical to reaching the masses, reaching large numbers of employers to offer the advanced primary care. Our mission, it falls so nicely in alignment with Nava's mission of providing high quality, very accessible care and being Amazon always talks about being customer obsessed, and at Amazon One Medical, we focus on being patient obsessed. Brandon, I'll pass it back
That's
to
all.
you.
Yeah, no, it's awesome. And for those of you that don't know us or myself, I'm the CEO of Nava Benefits. And we are the first benefits brokerage oriented entirely around the mission to bring high quality, affordable healthcare to all Americans. And we're doing so by serving the 150 million Americans that get their healthcare through an employer, an HR team. And what we're really focused on doing is how do we bring the strategies, the technologies, the tools, the benefits like One Medical down market out of the Fortune 500 into the hands of small and medium sized employers across the country. To provide better benefits for their employees at lower cost. And then we built a bunch of technology to help HR teams get out of the weeds of benefits administration so they can focus on things that they love to do. And so that's our why. And yeah, plus one to what you said, Leslie, I think our missions are deeply aligned here. And you called it out. One of the things we're really excited about too is One Medical is one of Nava's preferred partners. And what that means, that's a program that we stood up, which is about aligning with benefits providers, vendors, and service providers that really do exceptional work in sort of the vertical that they're in. And we saw that hand, I'm a One Medical customer, as is Nava. We just sort of we saw the success of of the product, and so now they're a preferred partner, and we're able to bring that capability down market into Nava's client base. So excited to dive in, and maybe we can hit the next slide. We'll start with the sort of the first piece here, which is around like, let's talk about the system and why we think it needs to change. And if you click next, I think a few things that really resonate with us. And I spend my time on the front lines with HR leaders, with benefits leaders, thinking about plan design, cost, employee experience. And I think the biggest headline here is like, employers struggle to get value out of their healthcare spend. We were literally on a call with someone who is now a new Nava client, and she was talking about, I feel like we're lighting money on fire when we spend money on benefits and healthcare, because it's so hard for them to get those benefits into the hands of employees, educate employees. And so things that we think about as sort of fundamental drivers for like the change needed is healthcare costs are going up at 2 to 3x inflation. Kaiser Family Foundation estimated that 2025 increase for mid-sized employers is going to be somewhere on the order of 7 to 8%. That's just on healthcare inflation. Something that we really are passionate about is how many employees actually just do not even have access to a PCP and don't have a PCP, and so therefore they're not getting access to primary preventative care. And then something we hear very consistently from the HR teams that we serve is that they're suffering from point solution fatigue, like so many different little slices of value being delivered across different products that is both burdensome for them as administrators of a plan and burdensome for employees who are just trying to figure out, how do I get access to care? How do I solve this specific healthcare problem? And so these are a few things that really light us up. These are things that we believe are problems that need to be solved. We're oriented around doing that for our clients, and partners like One Medical help us do that. Maybe before we go on to the next slide, Leslie, anything else that you wanted to kind of call out here before we kind of hit the impact of primary care?
Right now, I think the next slides will help paint the picture of the importance of primary care. So let's go ahead and go to that next slide. And there's this great article that came out of study about the impact that primary care has in the United States. And so by adding one primary care physician to a population of 10,000 Americans had staggering cost savings and life saving and health savings results. So hospital admissions decreased by 5.5%, emergency room visits decreased by 11%, and surgeries by 7%. So as you all know probably too well, when looking at your overall utilization, the costs associated with the emergency room, surgeries, and hospital stays, not only are they incredibly expensive, but they are inflating and increasing rapidly. So by really focusing on that patient relationship with a primary care physician, they truly can be your quarterback. They work upstream to help prevent chronic diseases, help keep you healthy, keep your employees healthy, keep them at work, which is so important. And they can then help coordinate care as needed with a specialist if that's needed. But with advanced primary care, they get more time with the patient to help prevent needing to go to a specialist as often, which is wonderful as well, because specialist costs are also increasing. This study here showed the cost of chronic diseases and the impact on presenteeism, which is so interesting. And that from asthma all the way through cancer, the time away from work increases dramatically for these patients. And so again, having that close relationship with a primary care physician who can help manage these chronic conditions and ideally help prevent them where possible, that also has a significant impact on the workplace and keeping your employees in their seats at work, doing the hard, great work that they love to do for you.
I think one just stat there that just blows my mind is that 66% of all healthcare costs that that essentially is running through an average plan is driven by treating chronic illnesses, which is sort of wild. Uh, cool. Yeah, let's continue. This is great.
Absolutely. So, as many of us are aware or have experienced ourselves, going to a primary care doctor traditionally has not been the best experience. Many times, when you call to make an appointment, there's a minimum wait of 21 days. I don't know about you, but if I'm not feeling well today, I don't want to wait 21 days to see my doctor. Hopefully, by 21 days from now, I'll be healthy. And so that leads to many patients seeking alternate care, such as going to an urgent care or an emergency room to get the care they need faster. It's also very inconvenience for the patients. Many times there are long waiting times that they have. So even if you show up for your appointment on time, the average primary care patient is waiting 20 minutes to see their doctor. So adding to time away from work, family, the rest of their lives. And then when they finally do get to see the provider, it's very quick appointments. On average, they're between 10 and 15 minutes you get with the provider. Many times that provider is very much consumed with their laptop through that visit to make sure all the notes and everything are in the visit. It is quite rare for a primary care physician to be able to sit and have a conversation the way our current fee-for-service model is built around primary care.
Yeah.
So yeah, I was gonna say,
I
so we'll
would,
pass it over to Brandon because how are we gonna make this better?
no, that's great. And maybe just even to kind of click on this, because I want to, this is something where it's like easy to, it's, this is such a powerful idea and problem, right? And I'll add a couple of things that we just see through, we serve nonprofits in upstate New York, we serve tech companies in San Francisco, and sort of everyone in between. I think a couple of things. One, on the inconvenience side, that 20-minute doctor waiting room visit isn't including the oftentimes 20 or 30-minute drive to and from, that provider appointment. And I think one of the things that we've observed is like in this sort of like millennial and Gen Z community, the idea of waiting 21 days for something is almost a non-starter. It's just like does not compute in sort of the age of like, I use DoorDash to like instantaneously get French fries sent to my house. And I think what we've seen, especially with that community, is they're sort of like opting out of that system. They're going like, well, I'm just gonna, like hope. And then what they're opting into is urgent care, emergency room type of sort of interactions because that's sort of the just the right now thing. And I think that to me the thing here that we've spent a lot of time with our clients on is sort of this big idea of how do we make it breathtakingly easy for your employees and their family members to get access to core primary care. Like that's the big idea, and like that's resonated so much with the HR teams. They're like, that is like we agree with that idea of how do we get there. And I think what your data is kind of showing, I think, is two things. One, the sort of the challenge of delivering on that in the kind of existing PCP sort of infrastructure where it's 21 days, lots of driving, but then also the positive impact of doing it, right? Like the PCP sits upstream of so many chronic and acute health issues that if you can have a great PCP relationship where there's low friction to getting answers to questions, it's easy for you to say, hey, should I get this checked out? Or man, is this mole a thing I should worry about? Or, like I'm thinking about X. How much of a game changer that is in downstream healthcare cost, which impacts both the employer plan and the employee, and of course, even more importantly, health. So I just want to make that to kind of tie that together and why I think this is such a big idea for the HR leaders that we serve for lowering the cost of healthcare and improving actual health outcomes for employees. Maybe we
Absolutely. And
can
I think
talk.
it helps show
Yeah,
why the current system isn't working well.
yeah,
How many of us have been in an appointment, you leave because you feel rushed once you finally do see a doctor and then go, I forgot to ask about X, Y,
yeah,
and Z. Well, I guess I'll just have to remember next time I go in. And so a lot of treatment
yeah.
there isn't either time to get to answering those questions, and then a lot of people rely on the internet also to get those answers, which is not necessarily the most reliable option as well.
Yeah. Yeah, Dr. Google is being replaced by Dr. GPT at the moment, and
Exactly.
interesting. Yeah, and I think that maybe before we leave this sort of problem and opportunity stage is like, I think what I want to do is to make a business case for why this type of solution is accessible to small and medium-sized employers. And that's just really our passion point here. It's like, how do we do that in a way that's affordable and easy and and valuable? So why don't we keep going? Let's dive into sort of, I think, like the next leg in that sort of in that journey, which is like, how do we actually modernize, this access point? Like that 21 days and like 20 minutes and 15 minutes thing sounds like it sucks. I feel that personally with myself and my own family. Like I have a very low tolerance for those things. Which kind of guided me to my solution. So maybe Leslie, I'll let you drive this from, kind of from here, and then I can color in my experience.
Absolutely. So we oftentimes focus on that overlooked powers that primary care physicians have. When a physician has time to spend with the patient and get to answer all of their questions, they can have increasingly value impact to the value of the service as well as to the care of the patient. And through Amazon One Medical, we can reach the patient in many different forms. We have our virtual care. So 24/7 access to a provider to answer your questions, hopefully keep you from searching that Dr. GPT to get the answers. And they can prescribe medications as well. And then we also have the convenient locations to come in person and meet with a primary care provider. For 30-minute visits is our typical time with a patient. And then when needed, we can refer to an in-network specialist if needed. But by having those 30-minute appointments, it allows the physician time to get to know the patient, cover a wide spectrum of questions that they might have. They utilize the PHQ-9 and the GAD-7 to help with depression and anxiety diagnoses and help get ahead of that. And then when needed, again, sometimes they need to refer out maybe to a psychiatrist, but a lot of the care can be treated within the I can't say the walls of Amazon One Medical, but the services, because we do have the physical locations, but also the virtual options. And so by being your healthcare quarterback, they really can continue to provide that comprehensive and continuous care to keep you healthy. And I know
Love
that's
that.
such a big passion, not just for Amazon One Medical, but also for Nava benefits.
Yeah. And I think maybe before we leave this, like I think this is I want to make sure that folks leave with this because this is, One Medical is an example of this, but this is a bigger idea, which is like sort of this, what is the next iteration of primary care? And so you call this advanced primary care, kind of your healthcare home base, but maybe like one level of abstraction up. What do you guys mean when you think about advanced primary care, this healthcare home base? Like, what are the high level sort of like principles behind that? Like these pillars?
Yes. So when we look at the overall for each of these pillars, so looking at that wellness and preventive care at every age level, there are preventive care services. I think most people start thinking about it more when they're 40 plus, but there are plenty of wellness screenings that can be performed as once somebody becomes an adult. We also have the preventive and wellness for pediatrics too. So I think those are oftentimes maybe not thought of as much when somebody's younger, maybe healthier, feeling well,
Yeah.
but why it's
Yeah.
so important to come in and have those baseline test results to be able to track over time. We can also
Yeah.
help with those everyday acute care needs. I'm going to use my mother as an example. She is a patient of One Medical, called me yesterday morning and had an acute illness. And I said, Mom, get on your app right now. Here she is in her mid 70s, got on that app. She was in the office within an hour and a half. And I actually saw her this morning, and she is on her way to feeling 100% better. So can help with those types of more urgent type needs. Without One Medical, she probably would have ended up either in an urgent care or after hours in an emergency room, which would have been much more costly. Can also help with, again, as we've reiterated, those chronic conditions. And this is really where we can make a great impact to helping patients stay healthy, learn how to live with their chronic diseases that they may have, learn how to improve and reduce their risks for them to prevent them over time. And then through the mental health and behavioral health care, because we do have these longer patient visits, we have the time to work with our patients, get to understand what's going on at home. You mentioned you're not sleeping well. Let's dive into that a little bit better. Oh, okay, you're having some stress in your marriage. Let's talk about that a little bit more. What impact is that having on your health? Let's get you in touch with one of our wellness coaches and being able to help support from all angles for the patient.
Really cool. So is it fair to say that this sort of like almost redefinition of primary care to this sort of broader remit of, this healthcare home base is like sort of like a direct addressing of that point solution fatigue of like, oh man, I've got to go to 5 or 6 different places to sort of like think about how I fill a prescription versus like deal with an acute issue, deal with like thinking about, mental health. Is that like a fair characterization?
I would completely agree with that statement. And because unfortunately, so many people have had a negative experience with primary care, it's even hard to believe that there could be a better experience out there. And that's oftentimes what we hear from patients when they come in for their first visit. I didn't know that healthcare could be done so easily and be centered around me. So often the model is built around the physician and the healthcare facility. We really try to build it around the patient, that patient experience. And with that, we see fantastic outcomes.
Love that. That's great context. And maybe one just reminder to folks, if you've got questions along the way, feel free to drop them into the chat. We'll try to get them either interstitial or at the end. Why don't we do a click deeper? So I think you've kind of defined the term, like let's move from traditional primary care to advanced primary care, solve some of these point solution issues, meet people where they need to be met. Let's talk maybe more specific about One Medical and actually dive into how you guys are doing that with technology.
Absolutely. So again, meeting the patient where they are. Easy, convenient. Our app is available 24/7. Our physicians go by their first names. They wear regular business casual outfits. They're not in the white lab coats. We want to make it feel comfortable, accessible. When you walk into a One Medical lobby, it feels more like someone's living room than a stark, cold doctor's office. Again, our offices are very sterile, that they are clean, but they are very warm and inviting in the environment to make it more comfortable for everyone. And again, that's all about focusing the care on the patient, what the patient experiences. We want them to see that we are invested in them and making a difference. So that we have an electronic health record that was built in-house specifically for primary care doctors. Everything they need is right at their fingertips, which allows them more time to be face to face, speaking with the patient, or face to face versus over video if it's a remote visit. But again, having every piece thought through that is built around the patient so the physician can be 100% dedicated to the care of the patient. We reserve slots every day so we can get you in for those same and next day appointments when you are having something that is more acute and needs to be seen more quickly. You actually can get in our clinics for your annual exam with those appointments as well. Most people, again, are waiting those 21 plus days, and we have times reserved for those every day. So our providers are able to perform those services. We can care for the whole family. We have pediatric services. I have, as I've talked about my mom, I also have 2 teenagers who are One Medical members, and The care they receive from their pediatrician from One Medical has been exceptional. When we just need to get in for those quick sore throats to, the annual wellness exams, the sports physicals for the athletes in the
Yeah.
family. All of that it can be done through our One Medical relationship with our primary care doctor.
Cool.
Um,
Uh,
yeah.
love that. Yeah, love that context. I think one thing that, and we got a good question in from Ewayne, if I'm pronouncing that right. But like, I think the thing that we have seen sort of both deploying this for clients as well as being a client of ourselves is like the digital component of it just makes things easier, like easier to ask a question, easier to book an appointment. Easier to do a lightweight virtual chat if you don't need to drive 15 to 20 minutes into an office, just like all of these different modalities. I think before we hit the next slide, Elaine, I think we're going to answer your question. He says, I'm not understanding the model of what advanced primary care is, what allows people to see a patient faster, and how does it become worth the practitioner's time? Maybe a little bit. And I think that's a perfect lead in to the
I
next
think
point.
that is too, to our next slide.
Yeah, yeah.
Exactly.
Which I think is great. And this is, and I want to set the table with this, which is like one of the biggest questions we get from our clients when sort of asking about, virtual medicine, virtual care, advanced primary care is like, what about the doctor? Like I get an app and stuff like that, but at the end of the day, I want to have a great doctor experience that knows what they're doing, that's going to spend time with me. So I think let's try to answer those questions in this next slide.
Absolutely. Yes. So our model at Amazon One Medical is set up a little differently than the traditional fee-for-service model. Our providers are paid on a salary basis, and they have much smaller panels of patients than the traditional primary care. We set aside 30-minute appointments for the patient and the provider. When in your typical doctor's office, when you go in for an appointment, usually there is somebody to greet you, to take you back, takes your vitals, asks why you're there for the day. And then later, the doctor comes in for a very short window. At Amazon One Medical, the physician actually greets you in the lobby. Our average wait time is 2 minutes. I still have yet to
Cool.
sit in one
Yeah.
of our waiting room chairs because we are able to keep our appointments on time and accurate. So when the physician meets you at the lobby, walks back, sits with you, they take your vitals. They talk through, oh, your blood pressure is a little high today. Let's talk about that. Let's and so it keeps it so the patient doesn't have to keep repeating themselves. It allows time to ask those questions. And then inevitably, if you forget a question to ask, that's where the app is also handy for that. I needed a doctor's note for my son for school when he had tonsillitis and was out of school. I forgot to ask for that in the appointment, sent a quick note to the provider, and she provided the note within an hour, and I was able to provide it to the school. So having that balance. Also, the virtual care option. So that's the in-person part, but then the virtual care options allow you to talk with a provider. Maybe it's the middle of the night. Maybe it's a time that isn't convenient that you can't leave to go into an office. Then you can have a virtual visit as well. And then I have also used the virtual visits to follow up after an exam. For example, having my blood drawn, get the lab results. We set up a separate time to then go through those lab results. I don't need to drive into the office for that appointment. We can just do that virtually. So making it easier on me, less of my time.
Yeah. Love that. It's really well framed. I think that maybe to summarize too, I think the points that sort of resonate with me. It's like you've got a different compensation model for your doctor so that they are not incentivized to like, I need to get through an appointment every 7 minutes because that's effectively sort of how I get comped salaried based on, member experience. And as a result, they spend more time with each of their clients. And you guys have done a lot of work to eliminate that sort of in-person wait time. which I think is cool. And I think the thing I've personally experienced, which is like when you combine that in person plus that virtual flexibility to go, hey, here's a quick question, I need a thing, etc. I feel like I'm much more empowered to, sort of like kind of control my healthcare journey, and the friction is much lower. Hopefully that answered the question. I think it did around sort of like how's this work and what makes the providers and practitioners able to do this. I didn't know that stat that it's a 2-minute wait time on average for in person. Super compelling. I've never had a 2-minute in-person wait time for any other doctor than that.
It is really incredible. And
Yeah,
I think it just goes to show we value the patient's time
yeah,
and want to be as
yeah.
efficient as possible, while still providing exceptional high quality care. We've also found that it has
Yeah.
helped our providers have a better experience. In the United States, we do not have enough primary care doctors in the United States, and there's very high burnout typically. Our turnover is significantly lower than the traditional primary care clinic model. Our providers love being able to spend the time with their patients. Having the 24/7 care means they don't have to be on call. Again, further reducing their burnout, allowing them
Mhm.
to be excited and want to stay as a provider for you for the long run.
Yeah. That resonates. I want to hit maybe two questions, I think, that are sort of like, let's get into like the hard questions, about it. I think one is, and we got this in the chat too, is like, where are One Medical's locations, right? Like, where are all
Yeah.
these offices? But I think maybe I'll expand on that because like we've gotten this question a lot, which is like, hey, listen, I've got, 15 employees that aren't close to a One Medical in person. Like, how does that work? Like, how can One Medical serve me if not everyone is within, like a reasonable distance of an in-person, One Medical clinic?
Absolutely. And in the appendix and the deck that we will share out, we have a map showing all of
Yeah.
our in-person locations, but we do have 24/7 nationwide, what we call our virtual Treat Me Now
Yep.
coverage. So if there is a patient that is not located near one of our near site clinics, then they
Yep.
also have access through the app to chat
Mhm.
with a provider. They can order medications, they can ask questions, they can review lab results all through the
Mhm.
app. And then if they happen to be traveling at some point and are near one of our facilities, they're always welcome to come in and have an in-person visit as well.
Mhm. Cool. And maybe a related question that we get a lot, which is just sort of I think it reflects a lack of understanding that a lot of folks have, understandably, is like how the sort of model works. A question we always get is like, well, how much does it cost me to talk to a doctor? Like, am I getting charged per chat interaction? Like, how's this going to work with my insurance costs and stuff like that? We hear that from HR teams. We hear that from members too. Can you maybe just hit that?
Absolutely. Yes, and as we were just talking about the rising costs of healthcare, right? I'm sure dollar signs are going off in people's heads. Absolutely. So we have a monthly membership model, and included in that monthly membership, it's on a PEPM basis, yet all dependents still have access as well for no additional cost.
Yeah.
The members get access to our online scheduling through our app, as well as the ability for that virtual Treat Me Now to talk with a provider 24/7, have those questions answered, get prescriptions filled. And then if you go in for an in-person visit, or you have a scheduled virtual visit, like my example of myself going through my lab results at a later date, then those visits would go through your insurance. And so for me, it goes through my insurance. I pay any applicable deductible and or copays and co-insurance
Yeah.
for those, just as if I went to any other in-network primary care
Yeah.
provider.
Awesome. Yeah. I think that's powerful idea for this group to take away is like it's kind of this sort of all you can use,
Absolutely.
real-time virtual support Q&A, that you're not getting sort of nickel and dimed, in my opinion, is kind of the way that I think about it. It's because like the traditional approach to sort of interacting with the healthcare system is literally you get charged basically every time you walk through the doors of a urgent care or a doctor's office. And this creates a much, and this is, I'm just so passionate about direct primary care, advanced primary care, because this creates the place where you can do those. Hey, I've got a question. Is this an issue? Can I get a prescription without getting nickel and dime? And then the actual scheduled visits you have are meaningful. They're like, oh yeah, we actually need to have a conversation about these lab results, or let's just do a well visit, and that just gets run through insurance. So in my experience, it's just a much more efficient way to interact with with the healthcare system and use our insurance, and for employers get a lot of leverage out of spend. Thank you for that. That's great. And hopefully that answered Christine, your question. Let's keep going. I want to, Leslie, anything else before we jump off of this one?
That's great for me.
On that last one. I want to, this is going to sound like a little bit of a plug for Nava, but I think it's just, I'm passionate about this. I think the ideas that we just talked through are pretty simple. How do you radically reduce friction between employees and healthcare, right? Like that's a big one. And how do you put employees sort of in the driver's seat when it comes to like meet them where they need to be met, virtually, in person, et cetera? That's something we're really passionate about at Nava. And actually one of the big drivers for us to do the preferred partnership with One Medical is the opportunity to integrate directly with them so that we can make things really easy, like managing eligibility, doing member support. So what you're looking at here is sort of Nava's application of that same set of ideas. Like the Nava Benefits app effectively is a benefits concierge for employees and their family members, kind of doing the same things that we're talking about with One Medical, but for all of your other benefits. So 24/7 support. If I've got a question about, how much does my, vision insurance cover for new frames, or, how do I use that specific, commuter benefit? We're there to answer those questions 24/7, help guide you to the right plans, access to all of your benefits, all of your digital ID cards in one place, so you don't have to go to 3 different insurance carrier websites or download 3 different apps, find a network provider, such like that. And one of the neat things with sort of these partnerships is One Medical sits right in there. So you can just jump right off the Nava Benefits app into One Medical, like into your app with kind of one place for all those things. So it's something we're really passionate about. And it's an idea that I want to get out into the marketplace, which is friction is one of the biggest drivers for why people can't get value out of all of that benefit spend that we are, that we're spending so much time and effort in kind of deploying. Why don't we keep going? We'll dive into Leslie. Maybe we just close out with a few minutes on kind of trends, and then we can talk a bit about strategy for HR.
And some of the cost savings that our member employers have experienced as well. Everybody is thinking, okay, how does this work financially? Well, what are my savings going to be? And so we've run a few different case studies looking at different employer populations. This first one here focuses on what we call near site. So our near site means that the patients are within a 25-mile radius of one of our 200 plus clinics that we have throughout the United States. And with that, we saw a reduction in urgent care visits of 57% from these patients and 26% fewer specialty visits. And I think this really ties into what we spoke about. Again, having those next and same day appointments held within the calendar so we can get patients in when they need to be seen keeps them from seeking alternative care. And then also having those longer appointments, really allowing the providers and the patients to get to know one another, and having the time to talk about those chronic illnesses helps reduce the need to see a specialist. Our case study number 2 focuses on a client that has an on-site clinic. So this would be a much larger employer that would have a medical clinic within their headquarters, as well as then patients have access to our near site. And we see significant savings there, and see 45% medical cost savings for this client with their on-site clinic. And significantly lower spend on the specialty surgery, emergency, and prescription drugs. Again, helping manage those chronic diseases. Many times it allows patients to reduce the number of medications they need to take. And pharmacy spend has been skyrocketing over the last few years. And so helping patients not need those medications saves significant money for the employer down the road.
Love that. Those are great. Those are great. Why don't we talk about the member experience side of things too? Because I think that's really
Yeah.
when we talk to HR teams, it's just like, what are employees actually saying about this?
Absolutely, yes. So we see strong enrollment when One Medical is launched. Through Nava, we help support communications to your membership about the benefits of advanced primary care, why it is such a value to sign up, get your dependents signed up as well. Our employee satisfaction rate remains at a 97%, unheard of in primary care. And so we are very proud of that stat, something we monitor on a weekly basis at each of our clinics as well. 51% of our visits are booked same or next day. And again, that less than 2 minute waiting time.
Yeah.
Like I said, I truly have
Yeah.
yet to sit in a waiting chair in the waiting room
I
at
mean,
One Medical.
it sort
And
of
it's not because I'm
like
late for
doesn't compute.
appointments.
Yeah, I think a lot of people like that can't be true. Like just
I
given their experience with it's like going to the DMV and waiting 0 minutes or something.
Oh my
Um,
goodness, wouldn't that
I
be a
think
dream?
yeah, yeah. Well, it's kind of I want to hit a couple of questions that we got that I think are around just the mechanics of this because I think these are good questions. They're sort of demystifying. One is how quickly can you get referred to or seen by a specialist outside of One Medical? What just walk through the mechanics of that because like you
Yeah,
can imagine, oh, this feels like
absolutely.
great. How do you go to the next step?
Absolutely. So, yeah, so we partner in each of our regions with a health system partner. So, depending on where you're located, I'm in Seattle. So, I'm going to use Seattle as an example. Here in the
Yep.
Seattle area, we are partnered with Virginia Mason Medical Center as our health system partner. And so, through that, should a patient need a referral to a specialist, we are able to get preferential
Mhm.
scheduling for our patients. So our providers send a note through our electronic medical record, which speaks directly to our health system partners' medical record, which is a wonderful tool. They talk to each other. And then the system recognizes that this is a One Medical patient, and they then get the preferential options for visits with specialists. So oftentimes, if you just call in off the street to get a specialist appointment, it could be a couple months. We typically see less than 2 weeks with our arrangements through our health system partners, which we really
Right.
appreciate. I had an experience, I keep using myself, but I think it helps bring it home as to how different ways One Medical can be used. My teenage son is an ice hockey player. He took a pretty big hit and he was complaining about some chest pain. He also was not feeling great, so it was hard to tell if the chest pain was from the coughing or from the hit. Was that happened on a Sunday night? I scheduled the appointment. We had an 8:30 appointment with our pediatrician the next morning. Went in, they tested him for everything under the sun. Turned out he had strep. So got that resolved, but they did want to rule out that everything was okay with the rib cage from the hit. And so scheduled the x-ray with Virginia Mason Medical Center. We left that appointment within 20 minutes. We were at Virginia Mason's x-ray center. They were expecting us, went in and got the x-ray, went and picked up the prescription, came home. And by the time we got home, we had the results that there was some swelling and some bruising, but no sign of a fracture. So all of that happened within about a 90-minute period from beginning to end. And we were able to get him on his way very quickly. So I think that's a great example of how that
Yeah.
partnership works so smoothly.
Yeah, and being able to leverage some more scale than a kind of a independent small PCP, for example, to actually do the care coordination,
Absolutely.
which
Yes.
is so important as we think about what great looks like. Amy asked a really good question too, and I think this is let's double click on this. Is there insurance needed if you have One Medical? How are there claims? How does that work? I think you hit on this, but maybe just again reinforcing. I think
Yeah.
it speaks to sort of people trying to wrap their brains around how One Medical fits into the sort of the provider community.
Wonderful question. Yes. So to be a One Medical member and having access to our 24/7 virtual care, you do not have to have insurance. We do try to partner with employers that do offer insurance. So when a patient does come in and have that in-person visit or the scheduled remote visit, those are billable visits. So we would typically bill that through insurance. If you did not have insurance, that would be billed as a self-pay. That
Yeah,
you would receive
great.
an invoice from One Medical for the equivalent price of that visit.
Cool. And then I think your second question is, are there claims? How does that work? I think your answer is yes. If you have a typical PCP visit or scheduled visit, that One Medical from the insurance rails perspective looks like a provider that will run that claim through whatever your insurance is. In my case, it is Aetna, for example. Is that a fair way to
Exactly. And then
characterize it?
you receive an Aetna EOB that shows the
Yeah.
visit, what Aetna covered, and then what your responsibility is.
Great. And then maybe another question we've gotten too is like, well, how many insurance providers cover One Medical doctors? Like, is One Medical in network or out of network, et cetera? Maybe demystify that.
Yes, exactly. So we have a great website through a link through our One Medical website that shows
Hmm.
every provider we are partnered with. Um, we partner with the health system partner. So keep going back to this Seattle
Yeah.
example with Virginia Mason. But if I'm in the Seattle area and my insurance is in network with Virginia Mason, then I am in network with One Medical.
Awesome.
In um, in New York, we are partnered with Mount Sinai. So if Mount Sinai is in network for you in New York, then One Medical is in network for you in New York. But again, there
That's
are
great.
hundreds,
Great.
if not thousands, of insurance plans out there that we are partnered
Yeah.
with. And to know each specific one, I would
Yeah.
direct you to the website.
Yeah, and I think for what it's worth, what we found is One Medical is basically a network with the vast majority of the insurance carriers that we work with through those large health system partnerships. So, um, awesome. Let's keep going, and then I'll maybe see if I can hit a couple of additional questions. But yeah, let's talk about where this is going. I think this is really interesting to me because, so why don't you hit on sort of roadmappy,
Yeah.
kind of the way you think about the future?
Yes, as we're looking ahead, again, always trying to meet the patient where they are. What are the
Yeah.
patients asking for? So we are seeing demand for expanded hours and evening visits availability. So in each of our regions, we are
Yep.
working to expand those. Some of our offices even have Saturday appointments as well, again, to reach the patient where they are. Women's health has been a big topic lately, family planning and menopause. We are in the process of getting 50 of our primary care providers trained in menopause, what's called a NOMS certification, a North American Menopause Society certification. To really focus in on the needs of women who are going through that phase of their lives. Primary care physicians traditionally get 4 to 6 hours of training in menopause throughout their entire medical school career. So we are trying to help balance that. And there's been lots of interest, which we're excited about. GLP-1s are also a hot topic. I'm sure you're hearing about it in the benefits community and from your employees. We really work closely with our patients on chronic conditions, and many times the discussion of GLP-1 management comes into those conversations. And because we are able to dedicate more time with the patient, sometimes those easy steps to implement around diet, exercise, lifestyle that can be well monitored mean a GLP-1 isn't needed. But sometimes a GLP-1 is needed, and that requires very close monitoring as well. And our providers are trained to be able to help the patient through their journey, as well as the journey of tapering off of a GLP-1 as well. that ties in so nicely to that continued expansion of chronic disease management to help patients through diabetes, heart disease, hypertension, and so on. And then we continue to expand our behavioral health that we're seeing the needs from our patients needing that care. And there is extensive research on the benefits of the primary care provider being at the center of the behavioral health care and being in touch with the coach and counselor, with the psychiatrist if that's needed. But again, we have coaches and counselors that are part of One Medical. And finding that balance and really wrapping around that patient to help them heal and be able to gain the skills to continue forward.
Do visits with coaches and counselors sort of look like a therapist visit that would run through insurance? Is that kind of how the
Absolutely.
audience should?
Yes.
Yeah. And then from if the right diagnosis, like, hey, you need a psychiatrist, is that a referred out, kind of like a specialty referral?
Absolutely. That would be where we would refer out to. I mean, again, you can go to any psychiatrist, but we do get the
Yeah,
preferential scheduling with our health service partner psychiatrists in that example.
very helpful. That's great. Yeah, love that. I think that, again, I think thing that resonates with me on sort of as you talked about this is like it's sort of that notion of like a home base, like one place to start, like as the jumping off point for an increasing number of needs, so that you're not having to go, okay, you got to go to point A or point B or point C to go start these journeys. It's super helpful. Why don't we, I think we've got about 6 minutes. So why don't we, I think we wrap up. And then we can, I think we've got one question I want to hit that was in the chat, but maybe we can hit key takeaways. Yeah, and I can take this or you can take this. Where do you want to start, Lynn?
Go for it, Brandon.
Yeah. Awesome. I think that, my wish from this conversation is that hopefully we've made a good case for sort of this transition and the value, the business value of advanced primary care as a concept, as a benefit to be offering your employees, and how it's like a major level up from traditional primary care, and really in addressing sort of at the outset people's sort of needs early on, more broadly, so that you get them the healthcare they need, you prevent things that could and should be prevented, and you help them avoid going into the emergency room and urgent care. And I think that the business case there is like, that's way better for your employees. It's a much better experience for them and their families. It feels better. But two, it's much better for your health plan. Like we see it bend the cost curve when it comes to the actual claims experience. So that's kind of number one. I think number two is the importance of accessibility and removing friction around delivering that. And I think that One Medical's done a great job of sort of melding technology with medicine to do that. I think that's the spirit of what we're trying to do, melding technology with benefits. I think the third, maybe I'll hand the third off to you, Leslie, because I think you do a better pitch on sort of like this kind of the holistic look at it.
Absolutely. Again, talking about the traditional primary care experience, having just a few moments with the doctor really does not allow does not provide an environment for the patient to really share everything that is going on with their health and their life. And by providing the advanced primary care model and having the time that is already built in and expected with the physician and the patient, they can cover a much more vast number of elements within your life, what you're experiencing, what you're going through, and then having that connection back to that primary care physician throughout your journey, whether it's a quick chat note to them or seeing them in person. Being able to stay in touch through that journey to help keep you well is incredibly important. Final example, using myself, a couple months ago, I was in San Francisco for a work meeting, got very ill while I was there, head congestion and such, went into the One Medical building, medical clinic that was near the office we were working at, was seen by a wonderful provider, and we got me through so I could fly home that night. my ears had lots of pressure. And the next morning, I had a note from my One Medical PCP here in Seattle saying, "Hey, I saw you saw Dr. So and so yesterday in San Francisco. See you're home now, just checking in, want to know how you're feeling. Let me know if there's anything I can do to help or if you want to come in for another appointment." I've never experienced anything like that before. And I just felt so well taken care of, again, because they know me through my whole journey. And it's not just because
Yeah,
I'm a
no,
One
that's
Medical
great.
patient. Other people get that same treatment too, or One Medical employee.
Yeah, I love that. Maybe I think that last key takeaway, measure, evaluate cost savings. I think the thing that we have seen is there's actually just a dollar ROI of investing in this, and that's I think two very specific examples. We had one client that we actually ended up removing 3 independent point solutions and replacing it with this, and it was just it was a net PEPM savings. But then there's all the downstream savings of just like reducing friction to primary care and all those things. And so I think there's a really compelling sort of ROI case to be made here in terms of hard dollar ROI, but also downstream sort of health impact. And that's something that we spend a lot of time on. It's like, hey, let's make a strong business case for, for the individual benefits that you're offering and the power of advanced primary care.
Absolutely.
Love it. Why don't we flip out 2 minutes? We can hit it one. I think we've got one Q&A. Please feel free to drop in Q&A in there. I think one question from me, Wayne, was how does a practitioner take their notes? Are they on call 24/7? It's a little bit like, how do you guys actually do it on the practitioner side?
Yeah, great question. So, note taking is done through our in-house electronic medical record. Again,
Yep.
built for the primary care physician. So the primary care physician takes notes. They may take some notes during the appointment. Then following the appointment, we build in time for them to put in the notes so they can have it while it's fresh in their mind. I don't know about you, but I can't even remember what I had for dinner last night, let alone after seeing a few patients, what a doctor would be like having to go back and do chart notes, which is more of the typical model. So this allows them to put those comprehensive notes in that then can be easily shared within any other systems. But we have that really
Yeah.
easy sharing with our health system partners. It's already built in.
That's awesome. Well, with the last minute, why don't we switch to our last slide? A couple of calls to action. First off, Leslie, thank you so much for the time.
Oh,
I think
really
two calls to
appreciate it.
action. Yeah, this is fun. And if you're interested in learning more, feel free to reach out to myself directly and Brandon at navabenefits.com. We can actually, I mean, we spend a lot of time with these folks. Pretty easy to walk through what that looks like, cost, deployment, et cetera. We've got an offer in here. You can just hit that QR code on the right. We will do a full benefits diagnostic. We basically evaluate your benefits offering relative to benchmarking your peers, whatever industry you're in. That's free. Good way for us to deliver value as a partner. And then on the left, the QR code just to get right directly to One Medical and explore the actual offering directly. It's it's a consumer product that we can offer through through the benefits plan. So with that, Leslie, thank you so much. This was a lot of
Oh,
fun, and
thank you
hopefully
all
we get the
so
message.
much for your time. Great
Yeah,
questions. And I hope our paths continue to cross in the future.
yeah, yeah. Excited for the partnership. I think it's been a lot of fun. Awesome. Well, we'll let you all go, and Leslie, have a great day too.
You too. Thank you.